I think a patient like this would benefit much more from elevation of her cheek. And for that, we have to build structure. And the structure should be built on the bone. So if you want to do injection with needles, we would inject in 3 points over the zygoma, and we would inject at the border of the orbital rim, like 3-4 millimeters distal to it. So that would be my injection points with needles to give the structure. But I think in a situation like that, I would also have the opportunity of going with a cannula, and then I think it's easier to coming from below and reaching the structure, the building of structure of elevation along the zygoma here with a 50 millimeter cannula. Also in her face, she has the jowling, and she has that obviously thanks to the fact that she has the mandibular ligament here and the descent of the cheek. And to inject her in the pre-jowl area, in this area to smoothen it in relation to the cheek will also give a lifting effect. For that, I will favor to use ultra deep along the bone, and then I will put RHA4 in the submalar area. And I think that is enough for today. So we're going to inject the left side. This is a good entry point. See that I don't have too many vessels. And then I always tell the patient that you will hear a little bit of a sound now. Always have a very careful look if you're going to inject a little bit more superficial in this area, that they don't have malar festoon between the orbicularis retaining ligament and the zygomatic ligaments, because that's an area which is very prone to edema. And I think it's so dangerous to inject superficial here and a high risk for irregularity. So basically I never inject superficial here, I always stay deep. So I tell the patient they will feel a little sound when I pass the ligaments. Obviously don't want to hit the bone all over time after time because it creates pain for the patient. But while you've got a little bit of volume in, you can go even closer to the bone. Supraperiosteally for the structure, and this is ultra deep now. So we're soon done with our first ml. That's it. So that is 1.5 ml of ultra deep soon. So I think 1.5 ml, we'll save that for the other side, the whole area. And it's a little bit more submalar.
So, and can you tell us what level you are in?
Now it's just under the zygoma. It is in the deep area just on top of the masseter, where the tendon of the masseter is inserting into the bone. 1 ml will help them, but you'll get much better effect if you inject them a little bit more. And this is 2.5 ml. Yeah, I think that's a good lifting effect of the zygoma, but she needs more there, so we can have another RHA4. That's 3.5 ml.
I think, Per, that is a tricky question. A house, and you can't build the house all in one setting. So what you do is that we're putting the base in the beginning.
I finished over the zygoma and the structural building on the left side. I think this really illustrates, if she bends forward, how much lifting she has and how much volume, that rejuvenation she has created in this midface. So what I have injected now from here, I injected 1.5 ml to build structure on the bone, and then another 2 mLs of RHA4 to shorten her lower lid and to give the submalar filling, which gives her, if you look here, a nice lifting along the jawline also, compared to the other side. Now, obviously, it hasn't obliterated her nasolabial fold, but it's smoothened it, and as I said, part of it is intradermal, and that needs an injection. So we spoke about giving her volume here, treating a little bit in the pre-jowl area, and giving injection here. Then I would give a substantial rebate on the company covers the cost for the syringes. Then obviously it's a good thing to give her a rebate.
can see here very well the deep medial and deep middle cheek fat compartments. Here you have the souffle, the orbit margin.
And you can see what we have achieved is a much fuller mid-face, shortening of the lower lid, and elevation of the mid-face. And if you look at the jawline, that jowling that she have been reduced by volume here and pre-jowl injection. We also injected a little bit less than a milliliter intradermally, where her nasolabial fold basically has been obliterated, a little bit in the marionette lane, but also intradermally in the midface. So total, with the both sides, it's 11 milliliters. Obviously a lot, but a big change in facial features for her, I think. Patient's extremely happy, she says. Thank you very much.